Hi, this is Sally from Health Motion, and you're here because you or someone you love has hurt themselves. Well, that sucks, because right now the way things are, you definitely don't want to go to the emergency room if you don't have to. All right, now I'm going to start with the disclaimer. Just like everybody else has to say, this information I'm going to provide you is not a substitute for individualized medical advice or treatment. If you have a serious injury, if you think you've broken a bone, if you're in severe pain or you can't sleep at night, or if you have any doubt at all, call your doctor, okay? They will get you some help. They'll figure something out. If you have a question, feel free to call our office at 616-554-0918. Somebody will get back to you within a day and be able to help you out. But the purpose of this video is to help you know what to do to take care of your body right away after an injury until you can get to a medical professional who can find the cause and give you a solution, okay? That's the purpose, that's the disclaimer. Here we go. Your body is very, very good at healing itself. We are amazing. Our bodies are amazing. So really, the purpose of medicine is to help your body heal itself, or to intervene when you've hurt yourself so bad or when healing has gone awry. That being said, when you first have an injury, and we're talking like, oh, I fell down and twisted my ankle, or oh, I sprained something, you know when it happened. It's not that you wonder when it happened, you know when it happened. That's an injury. So when you have an injury, you need to follow this acronym, PRICE, P-R-I-C-E. All right, here we go. The P stands for protect. You want to protect that area. You want to make sure that you're not going to do any more damage to that area. That's very important. Now, they used to recommend a lot of immobilization, but we found out that was bad, and that actually slowed down healing. So what they say now is R, relative rest. Relative rest means you need to move. You need to get your body going. You need to do things that are not going to hurt that area. So for example, if you sprain your ankle, you can move the other leg, you can move your knee, you can move your hip, you can move your back, you can lift weights with your arms. Just don't do anything that's going to hurt that area. And you will know if you have done too much because you'll have increased swelling or increased pain. So those are the two things to watch for in that time. The next thing after the R is I, that's ice. Most people are familiar with that. Ice helps control the inflammation. Now in this first 5 to 7 days after an injury, inflammation is very important. That's what brings all the ingredients that your body needs to heal itself to that area. So inflammation is important, but too much inflammation is bad. So we want to minimize that inflammation with ice. At most, you would want to do 10 minutes of ice every hour. You don't need to do more than that, and even that is kind of a lot. So if you can ice 3 times a day, that's fantastic. I like to use frozen peas because they mold to the area really well, and I've not seen anyone get frostbite from peas. I'm not saying it's impossible. Please use common sense. Put something between the ice and your body, and if it starts to hurt, take it off. If you get numb further away from the ice, like if I'm icing my elbow and my fingers get numb, that's a bad idea. That usually means I've numbed the nerve, and we don't really want to do that. So if you're starting to get numb further away, take the ice off. So we've got the 3 things, P, R, I. The next 2, I really group them together, and I only use them in cases of extreme swelling. And they really only work for your extremities, your hands and your feet, your arms and your legs. And that stands for compression and elevation. So compression would be using something like an ACE wrap. One of these here, you can buy them at Walgreens, Myers. You can order them online, I'm sure, if you don't want to go out to the store right now. And you wrap tighter on the farther away parts and looser on the way up, and that encourages the inflammation to move up your arm. It's impossible for me to give examples of every possible type of compression wrap. If you need them, I'm sure you can Google compression wrap for insert body part here. like compression wrap for the ankle, and you could look at a video tutorial that would show you how to do that. As I said, I only really use that in extreme cases of swelling or where that swelling itself is painful. And the last thing is elevation. So elevation means getting that body part higher than your heart. So if I've injured my wrist, I'm going to get that up here. The reason that we do that is that we want all of that swelling to be able to drain down. For a foot, you would put your leg up on a footstool or lay down on the couch and put your leg up on the back of the couch. That's going to cause everything to help come back, let your body process it, and get that excess inflammation and swelling out of there. That's one reason that feet and ankles tend to stay swollen longer, is they are down, they are below the heart. So those C and E, compression and elevation, I really only use in cases of extreme swelling. They can be helpful, but I don't always find them completely necessary. So this is what you want to do. You want to protect, relative rest, ice, compression, and elevation for the first 5 to 7 days. After that point in time, you can do more, and I will have more videos that are based on the problem to help you know what to do next. So try these things, or help your friends try these things. Stay out of the emergency room and feel better.